National Health Survey was launched by the Health Minister today, along with plans for a child mental health strategy.
Like most students, Arshdeep Chima strives for the best grades possible, but as a daughter of migrant parents, she says the pressure to achieve is intense.
Our parents have gone through so much, and you feel like you basically have to make up for the struggles that they've faced.
In her teens, Arshdeep was diagnosed with crippling anxiety,
to the point where I just didn't feel like I could function anymore.
Today, the Federal Health Minister announced he intends to gauge the scope of the mental health epidemic in Australia with a 3-year-long intergenerational health and mental health survey.
To give us a degree of depth and knowledge never before present in our understanding of mental health challenges and conditions.
He also wants a child mental health strategy by 2020, working towards a goal of a zero suicide rate. The National Mental Health Commission says achieving that will require changing assumptions that people who need help will seek it.
One of the challenges with the current system is it's an expectation that they connect with the system. We have to turn that on its head.
Suicide rates have steadily increased over the years, from 2,300 in 2008 to over 3,100 in 2017, making suicide the leading cause of death among people aged between 15 to 44 years. While the rates among Aboriginal and Torres Strait Islanders are more than double the national average. The research shows that half of all mental health issues present in adulthood have already emerged by the age of 14, making early intervention essential to minimising the impact of mental illness across a lifetime.
Often things have started way back, in the preschool and primary school ages, and I don't think we're doing enough in that space to recognise the problems.
She says educating parents is a good first step.
Better education about when is it a bad day versus early signs of a mental health problem.
With her bad days now few and far between, Arshdeep Chima is studying public health and hopes to work with reforming mental health services for migrants and refugees. But she says it will be a long road ahead.
Conservative communities will not open up to something like this anytime soon.
Dinham, SBS World News.